I'm Bob Lincoln, and I'm the Chief Human Resources Officer here at the laboratory, and I want to welcome you and thank you for coming in today. We were very pleased, we had 2 meetings yesterday as well, and probably had the combination of both meetings about 500 people, and I think we're probably going to be about maybe 75 or 80 here today, so we'll have reached a good number of the population of retirees, so really appreciate you coming in today. We're going to have several presentations by a number of people, and I'll introduce those people for you in just a moment. But the reason I want to introduce these folks is because sometime during the presentation or afterwards, we're going to open this up very broadly for a lot of question and answers. Yesterday we had a lot of good question and answers, seeking to understand, and I hope that we have that same kind of dialogue here today. So I'm going to open up with a presentation. Denise DeMiglio is going to follow me, and then we have a couple of people that are from Select Quote. So I'd like to have them stand up and introduce themselves. Okay, Denise, everybody knows Denise. You probably have talked with her hundreds of times on the telephone. Melissa Vitroff from our benefits department. And we have from Select Quote, Jeff Randolph. Jeff. Gary Fanny from Select Quote, and then Lori Quell. All right, so all of these individuals will have an opportunity to either present and or talk with us today and answer questions, all right? So, again, this is a very important topic. It is a change, and we want to make sure that when you leave here today, all of your questions are answered, okay? So we want to engage in that question and answer process, okay? So, as you know, the healthcare industry in this country is going under radical change right now. Probably more radical change than it's ever really actually been through in decades. And with that change brings a lot of uncertainty, a lot of changes in costs, and what's happening today may be changed in 2 years or 3 years from now. So what we're trying to do is anticipate some of those changes and dealing with the impacts to not only our employees, but also to the retirees. And as you know, the cost for benefits has continued to rise. We'll talk a little bit about that in a few minutes. But also, the costs continue to rise, and we anticipate that continuing to go on. So how can we, as an organization, continue to deliver health care benefits at a cost-effective manner that's for the company, but more importantly for you? Because as these costs rise, we have to really say, how can we help our retirees really deal with those increasing costs, and what is the best way to deliver health care? So that's what we're going to be talking about today. When we talked about what we were trying to achieve, we said, listen, there's some things that are very important. How can we possibly increase the number of plans for our retirees? Now, over the last 3 or 4 years, we've had many questions from the retirees saying, listen, we have 2 plans, and the cost of those plans are this and this. Do you have other options? Are there options that I can pursue as a retiree that may be a little bit different than the options I have now? So that's one of the things we thought about when we decided how we want to move this forward. Also, plan designs. We have 2 plans, 2 plan designs. Are there options in different plans? Because some people said, listen, this is expensive, I can't afford it. Are there other options in terms of plan design with maybe a lower cost that I could consider? In addition, one of the things that we got questions on is that the health condition of me and my spouse, is different. I may need one plan that has these kind of emphasis and this kind of coverage, and I'm very healthy and I don't really need that kind of plan. So how could we deliver different kinds of plans for different people that are a husband and wife or spouse, and be able to deliver that in an individual way that meets that individual needs? And so those are some of the objectives that we had in mind when we started to look at the solution in terms of the healthcare costs and different kinds of coverage and policy coverages. With that, as I mentioned, the healthcare system is driving changes for employers. And by the way, I might mention this, Brookhaven is not the only one in this case. All the other laboratories are in this situation. I'll talk a little bit more about that later. But also all the companies across the United States are dealing with these major changes. So we feel like we've come up with some very innovative ways and creative ways to help the organization as well as retirees. One of the things is looking at something called an exchange. You all received information in the mail about exchanges. And first of all, I want to talk to you a little bit about exchanges. These are private exchanges. They're not the public exchanges you hear about in the news, okay? Those are the ones that are associated with the the Healthcare Act, okay? And those are public exchanges. This is a private exchange we're talking about, all right? So totally different. But we're going to talk to you about what exchange is, okay, and how they work. But from a broad perspective, we have two plans here, as you know, Cigna and HIP. VIP, right, okay? We have those two plans, all right? And we are a very small employer from a standpoint of going out to the insurance market, okay? The insurance market, if you go to the insurance market with 2,000 lives, and retirees, we have about 2,000 lives, okay? We're not a very big buyer. So one of the things that we are where the exchange will do is that it allows you to go out and buy an individual policy through the exchange that we contract with. And what happens is you go into a huge pool. For example, some of the insurance companies that you might choose to select as an individual policy may have hundreds of thousands of people in it, up to millions of people in it, okay? So when you go into that plan, you go into a big risk pool, and that allows the highs and lows of claims to be spread out about a big population. So therefore, that drives the cost down on individual policies. We go into the marketplace with a risk pool of around 3,000 people or 2,000 people can't do that, okay? So that's one of the benefits of going out to the exchange and going to individual policies. That's how we can make this better for everyone. So with that being said, okay, I want to share with you some information. This is an eye chart. Sorry for the people in the back, but let me help you on this. Up here, this line right here, okay, that's a line that speaks to pre-Medicare retirees, people who retire before they're 65 years old. And in 1993, 46% of large companies provided health care coverage to pre-65 retirees. If you look from 1993 all the way down to 2013, that 46% dropped to 22%. So you can see the impact that is occurring over that 20-year period where companies are doing less and less with pre-65 retirees in terms of providing a retiree medical plan. If you look at the bottom number, that's for post-65 individuals who are Medicare eligible. And in 1993, 40% of the companies did it. Now, there's only 17% of the companies that do that. So you can see there's a trend in reducing that over time. Now, you saw on my first slide, BNL is committed to continue to provide assistance to you in your retiree medical, all right? So we're a part of that 17%, if you will. Moving on forward, if you take that 17%, that universe, what you'll find that 9% of those 17% of those organizations, the employer pays entirely everything for that individual retiree medical. 49%, the cost is shared between the company and the individual, and in 42% of the cases, it's really paid for totally by the retiree, and they have access to medical plans through the company, okay, but they pay the entire amount, okay? So I just wanted to give you that feeling. Now, right now, our retirees are paying anywhere from 30 to 40% of that premium. We anticipated that that's going to go up next year, okay? But instead of doing that, we've come in with the new concept of an exchange, and we're going to talk a lot about that today, all right, and answer your questions. What's the rest of the laboratory? What are the rest of the laboratories within the Office of Science and within DOE doing, okay? Right now, there are two of these organizations right here, the Office of Science, which is ORNL and PNL, who have gone to employ exchanges. That prior to FY14. BNL and Fermilab are moving to that effective January 1. So Brookhaven and Fermilab are going to be introducing the exchanges to their employees like we're doing today, but for effective date of January 1. JLab and Argonne, okay, Jefferson and Argonne, they're considering this change in 16. There are 4 labs within the Office of Science that are associated with the universities, and right now they're not contemplating that, but that's going to probably be on their agenda too. But those labs that are associated with universities, their benefits are tied in with the university, so those are not going. Now there are 6 other national laboratories, and there are 3 labs that have already transitioned to exchanges: Savannah River, Sandia, and Lawrence Livermore. They have already gone to exchanges. There are 2 labs that do not provide the retiree medical benefits, and that's the National Renewable Energy Lab and Idaho National Lab. And then there's 1 lab that right now is not planning to transition, and that's Los Alamos. So you can see what's happening across the laboratories in this regard, okay? And by the way, this is happening with not only in the Department of Energy, but also with the companies in the private sector. A lot of these things are happening. Again, the reason being is it can be much more cost effective for the organization and for the retiree, okay? So with that being said, I'm going to ask Denise to come up, and she's going to go into a few more details, all right?
Thank you, Bob, and good morning, everyone. So Bob started to set the stage and tell you about what we've been doing and where we've been going, and we've been looking at trying to find solutions for healthcare needs, and we've been listening to you being concerned about the costs going up and plan changes over time, and that's why we're here today telling you about the new program for January 1, 2015. We will be implementing a private healthcare exchange with a health reimbursement account. Okay, I just threw 2 terms out there, an exchange and a health reimbursement account, that we'll talk about just in a little bit. What this new program will provide to you is more options. More options as far as plan design choices, whether you pay a deductible or a co-payment, or whether you don't, and what those levels are, and how much you pay for your premiums. Some of the programs in this exchange are as low as $0 per month, while others have a higher cost associated with them. So you'll have a range of options, which is one of the things that we've been hearing you've been looking for over the past few years. With this program, the exchange, you will have a personal benefit advisor through our new vendor, SelectQuote. You've been receiving materials from us and from SelectQuote that contained information about the new program, and you may have already received a phone call from a SelectQuote representative, and if not, we're going to encourage you to start that conversation by reaching out to SelectQuote by calling the number in one of your packets. What this new program has the ability to do is to provide both the retiree and the spouse, and if there's a dependent child who's on the program as well, to provide them the ability to select different programs. So who am I referring to? This program is for Medicare-eligible retirees, Medicare-eligible spouses, Medicare-eligible participants of the BSA long-term disability plan who are receiving benefits from that plan, and any eligible dependent children also who are eligible for Medicare. Under this program, you will receive a contribution and amount into an account. This is the HRA Health Reimbursement Account. And you'll use that to be reimbursed for a portion of your premium or all of your premium. There may be money left over that you can use for co-payments. So it's up to you what you select and how you utilize the money. But the one requirement we do have is that you select a medical program through the SelectQuote exchange in order to be eligible for the amount that we're going to put into the HRA for you. Right now, you have two plan choices, the Cigna PPO and the HIP VIP HMO program. Those programs will go through December 31 of this year, and then they will end. So it's very important that you are in touch and selecting a medical plan through SelectQuote so that you have a medical plan in place starting January 1. So how do you pay for that? Well, right now, you're sending in a check, or maybe you have an automatic deposit set up with P&A Group. Now, that will change. For those of you who are eligible for Medicare, you will now, starting with the January 1 program, begin to pay for your insurance directly to that insurance company. Brookhaven will put $170 a month into an account for you, and you will be able to be reimbursed up to that $170 a month, and you can put that toward your premiums, co-payments, deductibles, and if you still have other money in there and you choose to, you can put it toward dental or vision coverage or expenses that are eligible. We will notify P&A Group that you will not need to be billed for the coverages that are starting January 1. Now, there are some of you who have coverage for both a husband and wife, and one person is eligible for Medicare and the other is not. That means that the person who is eligible for Medicare will go on this new program with the exchange and pay the insurance company directly. The person who is not eligible for Medicare will remain on the programs that the lab provides for that group and will continue to get a bill from P&A Group. So some of you may see two things. One, you may yourself be eligible for Medicare. You'll pay the insurance company. Your spouse, if they're not eligible for Medicare, they will be having the bill directly from P&A Group. Who's not eligible for the new program? This program, as I said, is for Medicare-eligible participants. So if a person is not eligible for Medicare, such as a retiree, their spouse, or their dependent child, they will not move to this new exchange, nor will employees. But retirees, long-term disability participants, spouses, and children will indeed move to this program when they become eligible for Medicare. BSA and SelectQuote will reach out in advance to all of these folks to make sure that we transition you to that program when you're becoming eligible for Medicare. Okay, so I talked about an exchange and I talked about a health reimbursement account. Let's talk a little bit more about what does that mean. An exchange is an organization that's set up to facilitate you purchasing health insurance. And they have the knowledge of the different programs. They will be able to assist you in selecting the programs that best meet your needs. Maybe you're looking for a zero premium program and you're willing to pay a little more for your co-payments. Maybe you don't want any co-payments at the doctor's and you want to pay a little bit more in the premium for that. Those are all different options that are available through the healthcare exchange. That exchange is being provided by SelectQuote. This exchange is not part of national healthcare reform. It's not a public exchange. It's a private exchange, once again through SelectQuote. So what's the health reimbursement account? That's the vehicle that we will deposit money into so that you can pay eligible expenses. We will be putting $170 per participant into the HRA. If both the husband and wife are Medicare eligible, that means we put $170 per participant, so 170 times 2, $340 per month per participant into the HRA. That's available to you to use however you want. It's a combined amount, and it's not that the spouse only gets the 170 and the retiree gets it. It's a combined pool of money in one HRA, a family HRA, and you'll use that however best meets your needs for your premiums, your deductibles, your co-payments, and other eligible expenses. So let's talk about how does that work. Okay. SelectQuote will work with you to obtain and secure an individual insurance policy. You will then pay your premium for that policy and submit the cost, proof of that policy that you just paid for each month to the HRA for a reimbursement of your expenses, up to the amount that's in the HRA. Brookhaven, once you've signed up for the plan, will put that $170 a month per participant in. That will start January 1st. And so that's how that money gets into the account that you can submit not only your premiums, but any claims you may have. Say you picked a plan that has co-payments or deductibles. You also submit those into the HRA and are then reimbursed. And you can set up automatic reimbursements for certain things. You can get a check. There are various ways that you can do this. You can submit by paper or you can submit online. So the HRA information, more details on this, will come out to you in early November. You'll get a summary of what an HRA is and how it works. You'll also get some frequently asked questions, and that should help to give you more information on this. If you haven't already had a phone call with a Select Quote representative, I encourage you to reach out to the phone number that's in your booklets. You would have received a Health Matters booklet, a couple of cover memos that go with that. Their number is in that information. They will be able to help you enroll in one of the plans, or maybe more than one of the plans, depending on your needs. There are Medicare supplement plans, Medicare Advantage prescription drug plans, and Medicare Part D prescription drug plans. Select Quote will come up here in a little while and describe each of these programs and how they work. So you'll get more information on that in just a little bit. So we've been looking at these type of programs for quite a while and determining the vendor that would be best to work with us. We wanted someone who will be there for your needs and ours. We wanted someone who could take phone calls on extended hours. So they go till 7 o'clock, I believe it is, Eastern Standard Time, Monday through Friday, and they even have hours available on a Saturday. You can have someone assist you with those phone calls, a friend, a family member. Please keep in mind, we found that they're very flexible in being able to assist you. Don't feel you have to make your decision on the first phone call. You can make multiple calls. They're there to answer your questions. And we are there in the benefits office here at Brookhaven if you have questions as well. If they're specific to a type of plan, we're going to refer you over to Select Quote because they have many years of experience and knowledge on each of the products. And each of the products that they have out there are A-rated in this exchange, so that was very important as well. So let's just go over a little bit. The enrollment is on an individual basis, just like Medicare. You don't enroll as a family, you enroll per person. So enrollment in this exchange is on a per person basis. If the family has Medicare and non-Medicare folks in it, the Medicare person is in this plan, the non-Medicare person is in the other programs that we still have available. They're not part of the exchange, but they will be when they become Medicare eligible. We will contact people when they get closer to that age. We will also work with new retirees as they are going into retirement to make sure they secure the appropriate coverage as well. We're going to open to questions and answers as we go along through this. At this point, I'm going to bring Select Quote on to go over the different programs that they have and how they can assist you. Jeff Randolph is here to start that off for us, and welcome, Jeff.
Thank you, Denise. I'm just going to kind of, I'm the bread, Gary's going to be the meat of our presentation, really talk about what Denise presented right before her last slide about the various products and how our benefit advisors and licensed agents will work with you to help you understand the products available on the exchange and how they meet your individual needs. I'm going to give you, again, a little bit of an overview when I wrap up about the HRA. Some information about the upcoming communications key resources. That's going to be at the end, and as Denise mentioned, we'll be here to answer questions as we wrap up. So, an overview of the changes. I'm going to discuss that briefly. Introduction to Select Quote. Gary's going to provide you an overview of original Medicare, the coverage options. Then I'm going to pick that back up and talk about paying for coverage and what the timeline and what kind of services you can expect from us. So Denise already covered this, but I just want you to be aware that 2014, you basically have group coverage that is subsidized by BSAs, group health coverage. They pay a portion of it, you pay a portion of it. That is pretty much the same thing in 2015. However, that basis of your health care is going to be an individual plan where you will pay first for it and then get reimbursed for a portion of that $170 a month and or $340 a month if both the retiree and eligible spouse are on Medicare. So Denise touched on this before as well, but I want to go to the last bullet is, why a private exchange? It's because we represent the marketplace of carriers that are available, competitive carriers, not just one company, and we give you choices at an affordable cost to best meet your needs. That's our goal. That's kind of been our passion since the founding of our company back in 1985. Our founder, Sharon Singh, and Gary will talk a little bit about him in a minute, but he started selling term life over the phone back in 1985. And again, it was the same philosophy as we expanded into our other lines of business is meet the customer's need from both a price and a coverage perspective. It's very important in the term life business. It's just as important in the Medicare business as it relates to your health care. Our exchanges provide a broad choice and competitive pricing, and good protection, and we've delivered over 1.5 million policies for our clients since our founding. Now, our actual unit that we work with the BSA benefit office on is called Select Quote Benefit Solutions. We help in structuring the communications, the process that you've been experiencing around engaging with our exchange. We have a call center, a website, we'll talk about that in a little bit, and then ongoing communications and manage the ongoing communications to you around selecting your product as well as activating your HRA. We provide the healthcare reimbursement account through a partner named Aclaris. And then we also work with Denise and Bob and Melissa in account management data. They kind of there, so they kind of understand where we are in the process. And finally, again, I mentioned our passion. We help you kind of understand the marketplace of healthcare options available that work with Medicare, and at the end of the day, help you make an informed choice with our licensed objective advisors and get you enrolled in a product on a timely basis so you have healthcare coverage effective January 1st. With that, I'm going to turn it over to Gary. He's going to talk about, our senior exchange and then the products and services available to you as an individual.
Good morning, everybody. I've had an opportunity to meet several of you this morning. I walked out and greeted a few of them and said hello and good morning and welcome. And again, to the people back there in the back in those end seats, remember, those are the ejection seats. So if you want to get up and leave, you've got the best go of it. I just want to remind you of what those are called. We didn't charge extra for those seats back there. I'm really excited to be here, and I have shared this story with the other two groups around here yesterday, and I feel like I need to share this with you as well. I am really scientifically challenged. I'm mathematically challenged, and my wife would tell you I'm just a challenged person. But I've got a son-in-law in Phoenix, and he's a material engineer. And Ben's been around for about 5 years now. I have never had a conversation of more than 5 minutes with him. We just don't connect. And just to give you an example, when I was in high school chemistry, yeah, believe it or not, I took that. You have to learn that the atomic, that chart they put up there, and there are these symbols for different things, like hydrogen, I think, was H, oxygen, or was something 0, I don't know, which kind of go together. But my biggest challenge was PB, which was, I found out later, that's lead. And I'm challenged because I don't understand. I've had a PBJ for years. That's peanut butter and jelly. I just don't see, I've never had a lead and jelly sandwich. So I just don't understand that whole concept. But when I told him that I was going to New York, because he was coming to New York too, and he goes, well, what are you going to do? I said, I'm going to go to Brookhaven National Laboratories. And all of a sudden, out of the clear blue, you would have thought I was his very best friend. I had over an hour-long conversation with him that day, thanks to you folks. Hour-long conversation in which I understood absolutely nothing, except I do remember okay, help me out here, the Large Hadron Collider or something. It's something like that, right? It's over in Geneva. I heard more about that darn thing. He took a tour of it. I heard more about that thing than I could ever imagine. And then Denise, thank you very much, drove us around and we got to see the new NSLS2. And I'll tell you, that's exciting. But anyway, so thank you guys for getting me into that. And I have a much better relationship now with my son-in-law. I'll probably never have another hour-long conversation with him, but thanks anyway. Okay, a little getting back here to what we're actually here for. Who has SelectQuote Senior? Well, number one, as Jeff said, we're a division of SelectQuote. And that's a very near and dear thing to me because I've known Sharon Singh, the founder of the company, for over 17 years. And I remember when they started this organization, 1985, Sharon said, hey, we want to go to the marketplace and sell term insurance, not face-to-face, not coming into your home every day and sitting down and browbeating you and encouraging you to get, the only way you're going to get rid of me is if you sign an application. And he said, I think I can do this over the telephone. People said, no, you can't sell insurance over the telephone. Guess what? They were all wrong. Sharon was right. As Jeff said, over 1.5 million policies. We have 140 agents right up here, 140 full-time, licensed, certified agents. We talk to almost 100 people a day. Each one of them. That's how many people that we talk with and communicate. Now, I will tell you, when we get somebody on the phone and we get into it, that time drops down, that number of people drops down. We're very, very, very close to the clients we work with. We get to know you. We get to find out more and more about you because it's important. Denise, Jeff, Bob have all talked about the individuality, and that's what we put into this whole process. The other thing is, not only are we licensed, we also have to take certification. The federal government requires every year that we go through a course, talk about fraud, waste, abuse, and all of the nuances of the products that come into the marketplace. We're licensed by the different states, by the different carriers. All of the carriers that we work with all have to have federally approved, and I say federally, I'm talking about the Centers for Medicare Services and Science. You might see it sometime, CMS, Centers for Medicare and Medicaid Services, and they do regulate what we do. There are things we cannot do that might make it easier for you, but we can't. Everything is scripted in some of our presentations because it has to be sent to them for their approval. Nevertheless, we do go through all of this. We also represent over 25 of the nation's top insurance carriers. Now, why do we have 25 carriers? Well, we're not married to any one individual organization. So consequently, they're not pressuring us to sell their products. So I don't have somebody from XYZ company coming to me and saying, hey, you guys aren't selling enough of our products, so we're going to get rid of you. Here's the thing. The reason we're not selling enough of your products is because you're not competitive enough. Given 25 companies, what does that give us the opportunity to do? Find the product that's right for you. We're going to look for the optimum product that's going to meet your needs. And you know what else we do? We look for the lowest price. And I'm going to get to that in just a second and tell you why and how that works. Understanding Medicare. Favorite subject of mine. I've relayed this story over and over again because I'm kind of embarrassed about it, but at the same time, it's what a lot of us face. When I turned 65, very frankly, I knew absolutely nothing about Medicare. I have been in this business, the insurance business, since 1968. I've done a lot of financial planning, estate planning. I have CLU, CFP. I've got all those little designations you need for the insurance industry. I did not know squat about Medicare. And there's a lot to know about it. So what I'm going to ask you to do, I'm going to challenge you today. Your business motto is a passion for discovery. So I'm going to ask you kind of sit back, and as I go through this, let's take that and let's discover what Medicare is, and let's discover exactly how SelectQuote Senior is going to bring this all together for you and make a really easy decision for you. You have to make that individual decision. You want to make sure it's the right decision, and we're going to help you do that. So we're going to understand Medicare if I can get the clicker to work. Here's how it works. To qualify, 65 years old. Turn 65, that's a big day. I remember my parents turned 65, they got Medicare, and they were just happier than pigs in mud, as we say in the South. Now, people under 65 with certain disabilities. If you're under 65 and you have a disability and it's over 24 months, on the 25th month, if you're collecting Social Security for that disability, you become a member of Medicare. And you get your little card. You become a card-carrying member of Medicare. Also, people with end-stage renal disease, that's ESRD, permanent kidney failure requiring dialysis or a kidney transplant. That's how easy it is to get into Medicare. That's all there is to it. Now, Medicare is divided into parts. And if you'll take a look, if any of you have gotten our little booklet, or the federal government's little booklet called Medicare and You. Anybody get this yet? Everybody seen this? There you go. Have you tried to look at it? It's interesting reading, isn't it? I tell you, well, anyway. There are a couple pages in there that are really, really worthwhile. And we always encourage people to take a look at that. But if you'll look at it, there's a chart. It talks about Medicare being Part A, Part B, and you'll see some other things we're going to elaborate on a little bit. But most importantly, let's talk about Part A and Part B. And the reason for that is if you ever look at a Medicare card, it has on there your Part A effective date and your Part B effective date. So that really is what most of us think about. Here's what Part A actually is. Part A is your hospital. That's what we almost always refer to it as. Then it also has some skilled nursing, nursing home, hospice, and home health care. Typically, there is no premium for Part A. I've always said that Part A, or Medicare, is really a generous, it's not a gift, but it's a generous benefit from the government that we've all paid for. The reason there is no premium normally is because of Medicare taxes. Take a look at Social Security. Take a look at whatever. They're still taking your Medicare out of there. Normally, it's about $104.90. I'll go into that in a minute, but it still comes out of there, even though we're retired on Medicare. Years ago, it wasn't that way. Then they started taking out of your Social Security as well. There are some deductibles, co-pays, and co-insurance. Now, a lot of people don't realize this. They think, oh, wow, I've got Medicare. I am taken care of. This is not going to be a problem for me. Hospitalization, doctors, no worries, no pain. Well, unfortunately, there is a deductible. Every time you go to a hospital with Medicare, and that's all you have, Part A and Part B, there's a $1,216 deductible. That goes up a little bit each year. And that's good whether you walk in for one day. However, it does cover a full 60 days. You come out of the hospital about 61 days later or longer, you have to go back. Guess what? It's another $1,200. There's also some co-pays and some co-insurance. So keep that in mind. I will also point out the benefit of Part A of Medicare and all those taxes we paid. If somebody did not qualify for Part A, you can buy it. The premium is about $441 a month. So that's what those taxes that you've been paid, that's what they're worth. That's what they're dollars and cents wise, that's what it's generating for you, a Part A. The other part of it that we're going to talk about is Medicare Part B. Because these are the two main parts, Part A and Part B, right? Now, Part B covers the doctor expenses. We just like to say that's for your physician, outpatient services, and what have you. Now, there is a little premium for that. It's $104.90. If anybody in here gets Social Security, you see that, it's right off the top. And that's, Uncle Sam grabs that pretty quickly. It could be more than that, by the way, maybe more based upon income. Uncle Sam does look at your income. There are certain levels. And if you make over a certain amount for joint, certain amount for singles, there is a higher charge. IRS, I will warn you, is about 2 years behind getting the information. So even if you had a drastic change in income and just went on Social Security, you may be paying a higher amount, even though you're not making that amount today. So just be warned. I've had the argument with my Medicare office and threatened to call my state senator, federal senator. They said, go ahead and call them. They can't do anything about it. Anyway, there are some deductibles, copays, and coinsurance associated with Part B. Now, the deductible in Part B is pretty minuscule. It's only $147. It's an annual deductible. So if I go to the doctor, I pay my $104.90 per month, go to the doc, show him my card, and give him my $147 deductible. However, there are some copays, and there's some coinsurance associated with Part B. And that's the scary part that most of us don't realize when we just have Medicare Part A and Part B. We get a lot of clients that just say, hey, I'm healthy, I don't need to worry about that. And then, of course, the next thing you know, the next day they trip and fall, they've got the dog on a leash, wraps around their legs, and they fall down and break a hip, and they've got $75,000 or $100,000 bill. Well, all of a sudden, they find out what this really means. I have to pay to go to the hospital, $1,200, but when I'm in the hospital, my doctor comes and visits me. That's part of Part B, physician charges. And guess what? Medicare is going to cover 80% of that cost. Whew. Take a deep breath, feel better, exhale, feel better already. But guess what? It leaves you with a 20% nut that you have to cover. You know what? If you stop and think about people you know that may have had open heart surgery, cancer surgery, treatments and whatever, you could have a bill. It could be anywhere from, if it's a $100,000 bill physician, you might owe $20,000. If it's a $500,000, you could owe $100,000. The point of it is, for financial security, you need to be aware that under Part B, you are responsible for this 20%. So Part A and Part B sounds pretty good. It is a great plan, by the way. I think the government has done a marvelous job with this and extends on out. But there are some problems. And not everybody can just sit down and write a check for those kinds of monies. Now, what do we do? Well, what we take a look at are some alternative, some products that can help you mitigate the costs. And those two products primarily are called Medicare supplemental plans and or Medicare Advantage plans. We're going to talk about each one of these. Under a Medicare supplement plan, there are a number of plans. Now, a Medicare supplement plan also is called a Medigap plan. They're exactly the same thing. Medicare supplemental plans and Medicare or Medigap plans, exactly the same thing. They're used synonymously. Here is a brochure. Some of you may have already seen this. It's called Choosing a Medigap Policy, right here. And again, this is put out by CMS, the centers. And we'll talk about this because we'll make sure if anybody wants one of these, I'll tell you how to get this and what we can do to help you there. But here's the way a Medigap or Medicare supplement plans. Now think about Part A, Part B of Medicare and the potential amounts of money you might have to pay. If you have a Medicare supplement plan, and by the way, they go through A through N. Those are the plans. You will not see an H, an E, you'll not see a H, E, or I, no, a J. They're not in there. They've been removed by Uncle Sam. Those plans are no longer available. So the big thing you do have A through N, but some missing in the middle. The most important plan that we talk about on a daily basis under Medigap or Medicare supplement plan is a Plan F. Okay? Now, Plan F is the most encompassing supplemental plan there is. When you're talking to one of our representatives, your advisor, they're going to start out with Plan F because, number one, it covers all of the deductibles, copays, coinsurance. That's number one. If you have a Plan F, it covers everything that Medicare A and B do not pay for, as long as they're medically necessary and approved by Medicare. That's Plan F. All of the plans have a couple features that are extremely important to you. Number one, when you look at the plans like the Cigna, PPO, the HIP-VIP, HMO, you have to go basically to a network. When you have a Medicare supplement plan, whether it be A through N, you can go to any doctor, any hospital, any facility, anywhere in the country, as long as they take Medicare. So you could be in Portland, Maine, and go to Portland, Oregon, and guess what? If you're not feeling well or you need services, you can go to any doctor, any hospital, any facility, as long as they take Medicare. That's important for a lot of people who travel. A lot of people like that freedom, that flexibility. It's all individual taste. But with the Medicare supplement plans, you have that available to you. You might also hear about a Plan N, like in Nancy. Excellent plan. Nothing wrong with it all. We sell quite a few of them. We sell more F. F is the #1 plan sold, I'll tell you right now. Because when you walk into the doctor and you have a Plan F, they've got your Medicare card, you show them your Plan F card, here's what's going to happen. You pay zero. You don't pay a deductible. You don't pay copays. You don't do anything except visit the doctor. And when you leave, there's nothing to do. Because the facility, the doctor, they will bill Medicare. When Medicare pays its part, they then bill the insurance plan. They pay their part. You're out of it. You pay a premium. It's not cheap, but you do pay a premium. And and you also, by the way, never forget that you always have to pay that Part B, $104.90 or whatever you might be paying. That's one thing you always have to keep in mind, and we'll remind you of that when you're talking with one of our representatives. That's a Plan F. Plan N, by the way, came up yesterday a couple different times. I'll just tell you right now, if you're looking at F and you're looking at N, I talked to one of the people yesterday. They've been working with one of our reps named Mary, and she was talking about a Plan F and Plan N. And Plan N does not cover excess charges. So I'll just tell you right now, Medicare does allow doctors under Part B to charge excess fees up to 15%. However, there are about 8 states, mostly in the Northeast, that do not allow Part B excess charges. So oftentimes, you might be talking to somebody, maybe it's not an advisor, maybe it's just your neighbor, somebody say, hey, I've got an N plan because it saves me a few dollars a month. Let me warn you about something. A lot of people my age like to travel. And if I'm traveling, and I live in a state like New York that does not have excess charges, but say I want to go somewhere else. I want to go to Scottsdale, Arizona, and I want to go to the Mayo Clinic out there. And there's a pretty specialized service. They can charge 15% excess. And guess what? If you have a Plan N, you're responsible for that 15%. Now, if you're back home, don't worry about it. But if you're in another state and they have excess charges and your Plan N would not cover it. I just want you to be aware of that. They also have a few little things like a little $20 copay, and it's not that big of a deal. My biggest concern about the N is the excess. And again, our representatives are going to go over every bit of this with you, but I want to tell you about that up front because we did have some questions yesterday. So I just wanted to clear that up. F is the optimum plan. It's the Cadillac. That's what you'll hear us say all the time of all of the Medicare supplemental plans. And then we have the ones in between. Okay? Now, another option, and I will tell you, prescription drugs that you see right here, they are not covered in supplemental plans. They used to be years ago, and Uncle Sam took those out. Remember I told you, CMS regulates this whole thing. Hey, the other thing that's really important to you as well, all of the plans are standardized. So Uncle Sam, people ask us, say, God, you guys have any brochures that can tell me what the prices are, and if I can really look at this thing and really compare all of these plans together? I can tell you right now, out of the 25 plus companies that we represent, all the Plan Fs are the same, all the Plan Ns are the same, all the As, they're all the same. What we do, of course, we look at our various companies, which by the way, all have to be A-rated, and I'll go into that in a little bit as well. But we look at that, and there is absolutely no excuse to pay more than you have to. So when we look at our companies and it says this company is X and this company down here is Y. Matter of fact, it lists our companies in an order that the lowest premium is first, and then it goes to the highest premium. And a lot of times somebody will say, well, how come that company is higher than that guy? It's just the way they're priced in that product in that geographic area, because everything's done on zip code. So when you talk to our representative and they're talking to you about these things, kind of have that in the back of your mind. Okay, but all the plans are standardized. And that's one of the reasons we don't just sell one product. Another thing that came up yesterday, I'm kind of just interjecting this because it's a thing that really concerns us at SelectQuote Senior. We hear a lot of people, talk about, well, my uncle sells Medicare supplement insurance. He knows all about this stuff. Well, come to find out he's a property casualty agent and he's got an in with one of his companies and they do some Medicare supplement insurance. The problem with that is you might get a product that has only, maybe a high rate, but that's the only product he talks to you about. With our approach, it's a little bit different, as I'm going to show you in a minute. So kind of just keep some of these things in your mind as you talk to our representatives, and all of this will really come together. Also, do remember, as I said, prescription drugs are not included in a supplemental plan. And I'm going to go over that with you towards the end because it's very important. The other approach, here's just some highlights again of supplemental plans. Private policy design and help pays healthcare costs. It's all issued by private insurance companies, and there is a monthly premium. We've already talked about based on zip code and plan selected. Does not include prescription drug plan, and you will need a Part D prescription drug plan in addition to a Medicare supplement plan. I'm going to tell you why you have to have it or why you need it in a little bit. Just going to plant the seed and keep it growing. Other option that you have, is to go to a Medicare Advantage plan. Now, people will say, okay, what is a Medicare Advantage plan? I like to tell everybody, hey, it's very much like a group plan. You have a PPO and you have an HMO. Okay, that's all network-based coverage. And that typically is the way a Medicare Advantage plan works. Same, similar concept. The great thing about them, they can have some very low premiums. The other thing is that oftentimes they include prescription drugs. And I'll just hit a few highlights. Again, this is health insurance offered by private companies that are approved by Medicare. We've had some people, they've contacted us, we've reached out to you, and they've had to, they've had to tell you that, hey, I can't really give you a specific price until the 15th of October. And people yesterday kept saying, well, why can't I get a price on it? Well, under the Medicare Advantage plans and prescription drug plans, CMS regulates them, to the nth degree. Actually, when you do an enrollment on a prescription drug plan, we actually have a script. It's so robotic, it's embarrassing to go through it. We even have to ask you to verify your gender and all. We know you, we got all the information, but Medicare forces us to use their script. So they're very highly regulated. Medicare Advantage Part C, by the way, when you go back to your Medicare For You book, there's a chart, lovely little chart in there, and it says Medicare and how it's all laid out, A, B, and then you'll see Medicare Part C. Well, that's an Advantage plan. And it provides all or a part of your Part A hospital insurance and Part B medical insurance. It includes Medicare prescription drug coverage for most plans. Those are referred to as MAPD, Medicare Advantage Prescription Drug Plans. Medicare Advantage does not supplement Part A and Part B. Remember we talked Medigap, Medicare Supplement, those two, that synonymous term? Those supplement Medicare. That's not the way it works with an Advantage plan. It actually replaces the benefit right here. It replaces the benefits of Part A and Part B. You still have Medicare. However, if you had an Advantage plan, you never use your Medicare card. You just give them your Advantage card. That's all there is to it. Each plan can charge different out-of-pocket costs and has different rules for obtaining services. Now, PPO, HMO, they do have deductibles. They do have co-pays. They do have some co-insurance. So with an Advantage plan, you will be paying money out of your pocket every time that you go to most of the time, when you go to a doctor or hospital or facility. Just understand that, okay? A supplemental plan, like a Plan F, not. You pay your monthly premium, and that's the end of the story. The MA plan offers something that I think is extremely important. As a matter of fact, this is the most important part of a Medicare Advantage plan. Now, I'm going to marry this back into original Medicare, because you might say, hey, you know, Gary, I'm healthy as a horse. I really don't need anything. Hey, and I'll just get me a prescription drug plan, and that's all I'm going to do. I'm just going to maintain Part A and Part B of Medicare. Remember the 20% I talked about under Medicare Part B? Also the excess charges. Who's responsible for those? We are, right? We're the ones who are going to have to pay that. There's no cap on that. Literally, you could wind up with God forbid, you could wind up with a $200,000, $300,000, $400,000 bill. There's no cap. Under the Medicare Advantage plans, they do put a cap, and that is controlled by CMS also. Last year, it was $6,700 was the most they could charge for in-network, $10,000 out-of-network. Plans I've seen so far for 2015, a couple of them have reduced that. They don't have to charge that much. They don't have to go to that level. But I've seen some $5,400 and so on and so forth. And a lot of that is just now coming into our purview at this point. But the key to it is this. I know under the Coventry plan, as an example, back in the Midwest, and I know it quite well, that my max I would ever have to pay in any given year is $6,700. And that kind of helps me budget. And it also gives me a feeling of security. However, the supplemental plan gives me a feeling of security from the day one, because I know that there's no cap. We had the question yesterday at both sessions. What happens if I become really ill and I have $1 million or $2 million of expenses? Can they raise my rate? Under a supplemental plan, the answer is no. Under a Medicare Advantage plan, the answer is no. This plan, an Advantage plan, is guaranteed for a full 12 months, calendar months. Supplemental plan, they can't raise anybody's rates. They can't kick you out of the plan as long as you pay your premium. They cannot kick you out of the plan. And even if a company happens to go bankrupt, it doesn't happen with our companies because they're all A-rated companies, even if that happened, Uncle Sam steps in and says, hey, guess what? You get to pick out another plan from another company. So you're well protected, well covered. But let me tell you, by just being on Medicare alone, you expose yourself to a lot. So you've got a couple ways to do it. And again, as I said, this is why this is called an Advantage plan. Tremendous advantage right here. And we're going to go through that with you. When you're talking to one of our representatives, and thank you very much for the couple of people that came up and said, hey, I've talked to Mary a couple of times. She's really been very helpful. I appreciate that, and I'll let her know that as well. Now, I want to get to, okay, we got supplemental plans, no prescription, Medicare Advantage plans, most of them do have prescriptions. We kind of talked about that. I think you've got a good grasp of what these plans look like and what they can do for you. Now, I want to talk to you a thing that's really an individual choice, particularly. And Bob started out, Denise mentioned it, Jeff talked about it. But one of the beautiful things about going to this type of a program is that you do have choices. And that's important to you. Choice is really important. And the reason for that, particularly for a husband and wife or friend, spouse, whatever you are, if you've got different prescriptions, one plan is not going to fit everybody. It's not like a pair of socks that one size fits all. It doesn't work that way. And here's the other problem that we run into and why it's so important to be working with one of our representatives. And I know you're going to say, and we've heard this, well, they ask me about my prescription drugs. I mean, why is it, before we even get into a plan? Well, the reason we do that is because under these plans, Part D is also part of Medicare. That's a prescription drug plan. All of the companies have different formularies. And so what happens is we load all of your prescription drugs into our system, and this is just an example of what a formulary would look like. This is one from one of our companies, and they send this out each year. It's about 60 pages of prescription drugs. It's wonderful reading for you. If you're having trouble, you have insomnia, you don't have to use NyQuil Z. You can just read this for 2 minutes, and you'll be sound asleep. But here's the thing. All of the companies have different approaches to their formularies. The number one, we have what they call tiers. And I'm sure you're all familiar with this because of your past experience. There are tier 1, those are preferred generic, tier 2, non-preferred generics, tier 3 are preferred brands, tier 4, non-preferred, and then tier 5 are specialty. And some of them now have a tier 6 where injectable drugs. Nevertheless, that's the standard within the Medicare prescription drug plans. Now, what happens is companies control their costs. And one of the ways they do that in prescription drugs is they might take a plan and, first of all, they might include a deductible. And the deductible last year was $310, I think it's $320 next year for most plans. They might include a deductible. Well, that kind of scares people away. Then the second thing they do is they'll move their prescription drugs by tier within their formulary. Also, they may remove a drug from the formulary. And by the way, if they do, and this question came up yesterday, if there's a drug they don't have in the formulary and my doctor says I need it, what do I do? Do I have to go to pay for it out of my pocket? Well, maybe. But typically, what you do is you and your doctor will contact the company and ask for an exception. These companies are there to help you and to work with you. And particularly going on next year, because of the way they're compensated by Uncle Sam, its customer service is very, very important to the Medicare companies now, particularly prescription drugs. So they may take a tier 1 and move it to a tier 3. Now, you get all that information, and one of the things that really bothers me is that I'll read some of these brochures. You walk into some, I will not name the name, you walk into a large store and you'll see a kiosk and they'll hand you a little thing, or you walk up to it and they'll say, you need our drug plan. It is absolutely spectacular, fantastic. It only costs X number of dollars a month. You can't beat it. And then you take a look at it and it looks great on paper. Now that plan has a deductible probably, and we sell the plan. It's a great plan for the right person. This is why it's so important when you're working with us that we get all of your information. Because here's what happens. If you're on generic drugs, tier 1, tier 2 generic drugs, deductible doesn't even come into play. They don't charge a deductible on those plans, on tier 1 and tier 2 for most part. And actually, some of them go clear up to tier 3 now. That's a new addition. But, and their drugs might only cost $2 or $3, and mail order can even be free. Sweet deal. And that's great for a lot of people. What bothers me, it just gets me every time, is when somebody, husband and wife, buy the same thing. And I've got one person that has generics, and then I've got another person, and I'm going to give you an example. This is actually a client that had that exact same thing happen to them. And I have to put my glasses on here. When you get my age, you have to have those, you know. Okay, this client was offered a low premium plan. And I got to working with him, and his wife, it worked great. She had 2 drugs. I mean, that's it. Her drug plan worked phenomenal. We got into this thing, and this gentleman has type 2 diabetes. He's on atorvastatin. It's cholesterol. That's a tier 1. Tier 2 at the most companies today. Where it got bad was in the glyburide, Januvia. Anybody type 2 diabetes knows what Januvia is. And then proglitarazone, tamsulosin, and vitamin D. That's really only 6. And by the way, I'll talk to people with 15, 20, 23 drugs. It's not unusual at all. That's why it's important, though, that you give us all the information and we get it from you. I know it sounds invasive, but there is a reason for that. When I ran a study for him, I went back to him and said, well, you're not going to believe this. That low-cost drug plan will actually, over the year, cost you over $500 more out of your pocket than it would if you paid a premium of $57 a month. That's the kind of study that we do for you. We dig deep into this thing. We have the formularies. We plug it into our system, and it calculates everything. And when it comes out to me, I look, and all of our representatives look at the same thing. What is the estimated cost for the year? Now, that's given the drugs you're taking right now. You may not have all of the drugs. You may add a drug. That's nevertheless, it's okay. It doesn't make any difference. That's based upon today. But I just want to let you know how deep we go into this thing. There are 4 phases. This is something new to any of us that had group insurance. And when you get into the Medicare, as I said, it's controlled. When you get into this, it has 4 phases. It could have a deductible. Some plans don't have it. In those cases, they only have 3 phases, actually. The initial phase is this. Once the retiree pays and the Part D plan have paid $2,960 in prescription drug retail cost basis, the retiree enters the dreaded donut hole. Anybody in here ever heard of the donut hole? Yeah, not the ones from Dunkin' Donuts, but from Uncle Sam you know what I'm talking about. It's also called the gap. And what happens when you hit that is that, for 2015, the retiree is going to pay 45% of the cost, and that's for the brand name, and then the 65% of generic drugs. When that total reaches $4,700, then you go into the catastrophic phase, and the drugs drop way down. I mean, the max you could pay basically is 5%. And you can have some generics could be like $2.65. It goes way down. And we're going to work through that with you. It's incredible. If you could see the worksheet that we use that comes out, it actually will take all of this information, shoots out what the plans look like, your supplemental plan. We look at that, then we look at this other part of it. And then we take a look at the drugs on a month-by-month basis. Can actually tell you, based upon today's information, we can actually tell you when you would hit the donut hole, how much your monthly co-pays would be. That's part of this whole thing that we do for you. That's all part of the prescription drug plan. Individual? Absolutely, because if you've got somebody, if you've got your spouse or your partner and they just happen to have different drugs, you can't go out and buy the same program. I'm telling you, it doesn't work for you, okay? That's how the prescription drug plan works. And then also you've got the retiree can submit RX expenses to HRA for reimbursement as well. Now, I said we represent over 25 top companies. These are a few of the companies that we represent. You'll notice a lot of them. You'll recognize a lot of the names. The big thing in here, again, is that all of our companies are A-rated. They're A-rated by a company called AM Best, B-E-S-T. Been around since about 1895. They're an independent rating organization for insurance companies, extending in even now to the property casualty and so forth. They rate based upon A, B, C, D, and F. And quite frankly, when I was in school, I strived to get an A. I seldom got them, but that's where I really wanted to be. You didn't want to be in the C, and B you didn't really want, and F you definitely don't want. But unless you buy a supplemental plan, then you do want an F probably. But just to let you know that it's A, B, C, D, and F. All of our companies are A-rated companies. When AM Best looks at a company, and by the way, we do not pay them to give us our ratings. They look at financial stability. What is the capability of that company to pay their claims? They look at statutory, they look at GAAP, they look at exactly where the company is on surplus. Very important. They look at how they treat their customers. How quickly do they pay their claims? How many complaints are out there against them? So there are a lot of factors that go into this. Again, our companies are A-rated companies, and there's a strong reason for that. The advocate that you work with, our representatives, my associates, my good friends, very objective, a trusted resource. And the reason for that is because we have these companies, and we have your interest at heart, believe me. Single point of contact. I'm going to expand that because it's not really just a single point of contact. Your representative is a single point of contact. However, we each have a concierge, and we will assign a concierge to you. You work with us, you get your policy through us, you'll actually have a concierge that will reach out to you, and you'll be able to work with that concierge. Mine's a guy named Curtis. They're all highly experienced, they're licensed agents, and they're carrier certified. I talked to you about that before. I can tell you right now, one of the certifications for AARP, UHC, it takes almost 8 hours of study just to go through this, and I've done it many times. I've done it for 4 years in a row, and it doesn't get any easier each time. They will conduct a needs analysis. Remember what I said, this is an individual decision, and it's one you have to make for you and your partner, okay? Because not all of them the same. All the socks doesn't work that way. Our services are provided to you at no cost. Brookhaven doesn't, they don't pay us to do this. Each individual company does not pay me. They don't pay Mary. They don't pay Christina. Our money, our income comes from SelectQuote Senior. We're all salaried employees. So it makes absolutely no difference to any of us what company you buy from us. It's a different concept. That was part of Sharon Singh's whole concept. Be objective, be unbiased. We are, I hate this term, but it's what he uses, we're commission agnostic. Right, Jeff? Right. Don't know what it means, but I like it, but that's what he says. So we are commission agnostic. That's important to you. There's one other thing that I would throw in here. One word up there is not there. One thing I think that should be up there. You guys, you have a passion for discovery. I've talked about that. I've asked you to kind of sit back and take this into consideration. All of our reps are very compassionate people. They understand what we're working with. And they become that way because most of them get stuck working with me. And so they get a feeling what it's like to be over 65 by just being around me. And they all feel sorry for me, I'm sure, probably, and that's what makes them very compassionate. But they do know what you're going through, trying to figure out which plan is going to be the right one for you. We can't lead you to that plan. We can't say, hey, you better buy this plan, but we can sure give you the roadmap and get you into that area where you make the right decision for you. And then, Jeff, will you wrap it up for me? Thank you all very much. There you go. What's the pointer? Which one's the pointer? Top one. Okay.
Thank you, Gary. I'm just going to kind of go over some of the resources available to you and the timeline on the communications and the services you can expect, both as you're making the transition and what you can expect in future years as well. One thing we have deployed is a website. You can kind of look at prices on the website. At one point, when January 1st comes around, you'll be able to access your HRA account through the website. The phone number is up here. What's that? The phone number, it's in the packet that you received in the mail, but it's 861-866-479-8317. And I'm going to digress a little bit because I think this is important in terms of, we had a couple of questions yesterday about why this can't be done in person. Do you have representatives available? What if I even lived in Kansas City? Why don't you have field offices? The point is this is a highly regulated industry as it relates to the Centers for Medicaid and Medicare Services. We're highly scripted on what we can say to you, how we enroll you in the product, all the disclaimers associated with that. And we follow a very strict process. That protects both us and you. All calls are recorded. So if there is an issue, the issues do come up, we can investigate it appropriately and resolve it quickly. Now, if an agent would come into your home that's not recorded, that doesn't have the same guarantee and tight quality assurance controls as a telephone call does. So I just wanted to give you a little bit of background on that and why we deploy our services telephonically. The other thing that's available on the website is some videos. There'll also be a recorded or a presentation of this presentation as well. There's additional copies that you could download of the materials that were mailed to your home. And these are just some examples of the information that was mailed to your home. There was an introductory letter along with the Health Matters packet. And that Health Matters packet is very important. It goes over some of the information that Gary covered, more in a summary way. It also has a worksheet in it that allows you to kind of assess your needs as you're getting ready to prep for your appointment with your advisor. So it has a worksheet for your prescriptions, has a listing of your physicians and hospitals, and it allows you to kind of gather that information all in one place to help you prep for your enrollment session or your consultative session. The other thing that you'll receive, as Denise mentioned, is, as she talked about, you have to pay your first month's premium first, and I'll get into that in a minute, but essentially you have to pay your premium probably before the activation date of January 1st. So in the month of December, or even when you initially, or before when you initially enroll, you'll be paying that premium for January 1st, as well as you'll still have to pay your December premium for your current coverage to the P&A group. So just wanted you to be clear on that. But then you'll be able to submit reimbursement for your Medicare product on or after January 1st. So here's just a brief overview of the timeline. You should have received the packet in the mail, both an introductory letter from Brooke from the HR office and benefits office, as well as the mailing, combined mailing with the Health Matters and introductory letter from SelectQuote that includes SelectQuote's information. We're doing the retiree meetings now. We have done a significant amount of outbound calls to try to reach everyone. However, we're working with the best information that we have. So if your number has changed, we encourage you to call us at that designated number. You will also get information in December or in November, late November, early December on how to activate your HRA account. And then for those currently that are Medicare eligible, your new coverage will take effect on January 1st. So I mentioned that you'll have your initial consultation. You'll have a product to select kind of the product you want to enroll in. In addition to that, you'll have, as Gary mentioned, you'll have to have, if you go down the supplement path, you'll have to select a Part D plan. So those are two important consultations. Those do take a little bit of time because of the scripting and the verification we have to make and your protection. You might have to give your name a couple of times, verify several answers, but it's well worth it to do the voice application that way and do everything over the phone. That way your coverage is for sure to be in effect on January 1st. Then we do a couple of more follow-ups as it relates to your onboarding process. Before the effective date, we'll call just to touch base. Have you received the cards? Do you have any questions? We do the same thing after the effective date. And then after 90 days after the effective date, we'll reach out with a satisfaction call. So that kind of covers your first year in an individual plan. Then that's your first year, and then the Medicare open enrollment period opens up again October 15th through December 7th. That really impacts those that have selected a Part D plan, and as you know, your health care changes, particularly maybe the drugs you take. So we will, again, you work with a retention specialist to see if you have any changes in your prescription drugs and look at a new plan, prescription drug plan in that period too. If you also want to look at a different Medicare Advantage plan, that would be the opportunity to do that as well. Now, you might have the question about Medicare Supplement. Because this is being recorded, there are different rules around Medicare supplement in the various states that the Brookhaven National Laboratory retirees live in. For the most part, this first time you're guaranteed issue, so you can choose any Medicare supplement plan or carrier that you want for the most part if guarantee issue is available for that plan. However, after that, depending on the state you live in, if you want a new Medicare supplement, you'd have to go through underwriting. So just wanted to make that clear, depending on your health status at that point. But as Gary mentioned earlier, the plan that you select, Medicare supplement plan that you select today, is guarantee renewable for as long as that company's in business. And since we're working with A-rated companies, that should not be a problem. As I mentioned earlier, there are two options for paying for coverage. Basically, you can have your premium automatically withdrawn from your checking or savings account. Some carriers might want use a credit card, but that would be at the end of the enrollment process. A majority of some of the carriers also will set up, the ETF, and you can kind of have to pay that first month, and then you can decide on what day of the month that you want to pay that premium out of your checking account or savings account in future months. And then some carriers also will send out a coupon book where you just have to submit by check, depending on your choice, premium each month. Denise also mentioned this, but I just want to make sure that you understand the health reimbursement account one more time. It can be used to reimburse premiums and certain out-of-pocket expenses. You have access to the account after you purchase a medical plan through SelectQuote on January 1st. Again, funds won't be available till January 1st. And as Bob has said earlier, this is a tax-free account that's available to you. So there's no taxes associated with this insurance. So the recommended use for your HRA, just to keep it simple, particularly if you go down the Medicare supplement pathway, is Part B. Your Part B premium is eligible for reimbursement. That's the premium that comes out of your Social Security check every month. You just need to certify that that's being paid. Might have to kind of snapshot your check that shows that's being deducted. But then you can set that up for recurring reimbursement through the rest of the year. Same way with your Medicare supplement and Part D premiums. So that's the easiest way to get your money, and if you do it from a direct deposit perspective, you pay after the first month, you pay your premium, you're automatically reimbursed through the recurring reimbursement process, and so that kind of keeps everything on track throughout the year. If you have any leftover funds, you can bank those for future changes because the amounts in the account will roll over year to year if you don't use them all. Or you can use it to supplement for out-of-pocket expenses, co-pays, co-insurance, things like that. And I just want to, say we're committed. As Gary said, we have a compassion for you and for this business because your healthcare needs in retirement can, expose you to a significant amount of risk. So we're passionate about getting those taken care of. But as I mentioned before, we have the videos and other educational content. You have access to the quote engine, as well as plan information that resides on the quote engine. Again, we have been doing, since the end of September, outbound calls to each retiree to confirm receipt of materials and schedule a consultation. And then we're going to do additional, more intensive outbounds as we gather more data on people that have been unreachable starting December 8th. So now I'm going to turn it back over to Denise, who's going to kind of wrap up and summarize everything that's been covered to this point.
Thank you. Okay, what I want to do is give a brief overview of what we heard today. So, what did we talk about? We talked about that the current program, Cigna and the HIP VIP program will end December 31 of this year. You will need to select a medical program through Select Quotes Exchange in order for Brookhaven to put the $170 per participant into the account. You must select a medical plan through that exchange, not through a separate exchange, not on the outside. So once you do that, you are going to pay that insurance company for your premium. You'll submit to the HRA, where we put that $170 for reimbursement of the premium. You can also get reimbursed for Part B expense, the medical premium for Medicare Part B. You can get reimbursed for copays, deductibles, other expenses, of course, up to the amount that's in that account. $340 for a two-person account. If you don't use all of it, it rolls over. How do you get started? You need to speak with a Select Quote representative. In some cases, you may have already heard from them. In others, I suggest that you give a call out to them. The brochures and information you have has that 800 number in there. And for some reason you don't have that, we have a copy of the booklet in the back. You can pay those premiums for the insurance company in various methods, setting up automated or setting up or doing a check. You can also get reimbursed for your expenses through the HRA on an automated basis or by them sending it directly to you. So you have options. What's the key here? Options. Options on the coverage you can select, differences in the plan designs. How much do I want to pay in the copays? How much do I want to pay in the premiums? Do I want to not worry about any expenses, and a supplemental Part F plan may provide that kind of coverage for you, versus maybe I want a different plan, a zero premium plan. Maybe I want a Medicare Advantage plan. Each person has a different story to tell. Each has a different need. This gives you options that range on your premiums as well as your coverages. A husband and wife don't need to select the same plan. Those are the options that are available for you for January 1/15. Now, not all the rates are out yet, so you'll find, although you're having conversations with the Select Quote representatives, maybe that they can't put you in a plan yet because the rates are not yet out from the government. They will be soon, by the 15th. So you'll be able to do that. So I'm encouraging everyone to please start those phone conversations. You don't have to make your selections on the first time, and you can have a family member or friends help you with those conversations. It's very important. We are also there in the benefits office here at Brookhaven to assist you. If there are questions regarding the individual plans, we will refer you over to Select Quote because that's what they have the knowledge in, that's what they're good at.